A question that people are wondering is, are people with diabetes more likely to get COVID-19? There has not been enough research or data to show if people with diabetes have a greater risk of getting COVID-19 compared to the general population. The only thing is people with diabetes can experience worse complications if they contract COVID-19. Another question that people are asking are, do people with diabetes have a higher chance of serious complications from COVID-19? The answer is yes. People with diabetes are more likely to have serious complications compared to someone without diabetes. If you have other complications with your diabetes, you also have a chance of having more problems. The virus can cause people with diabetes to have higher than normal blood sugars. Another question that people are asking are, what are the symptoms and warning signs that you should be looking out for COVID-19? And some people experience mild symptoms while others experience very severe illness. Some symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, and congestion.
Hi everyone! So another question that some people have regarding COVID and diabetes is whether or not the risks are different for people with type 1 or type 2 diabetes. And so type 1 and type 2 diabetes are obviously quite different, but since the CDC is continuing to update their website and doesn't currently have that much information on COVID as they would like, what they're currently reporting is that people of any age with any certain underlying medical conditions have a greater risk for developing COVID and a greater risk of getting a more severe illness to COVID-19. Based on what the CDC reported, people with type 1 or gestational diabetes have a little bit of an increased risk for severe illness for COVID-19 compared to type 2 diabetes. And as I said, because COVID-19 is such a new disease, they're still trying to find more information for it. So another really important question is, what do you do to prevent the spread of COVID-19 in your home, especially if you are living in close proximity to someone who has diabetes? And so for people with underlying health conditions, including diabetes, healthy family members in a household should take steps as if they were a significant risk to those individuals with diabetes. And so, for example, they should be sure to cover their nose and their mouth with a mask at all times if they ever leave the room to go and see their other family members. Stay at least 6 feet away from people who don't live in their household, and also wash their hands frequently before feeding or caring for the vulnerable person. And it's very important to protect yourself in that way, and also to protect the people around you, whether they have diabetes or not. So another question that people commonly ask is, what do people do who have diabetes if they get COVID? And so the most important thing is to stay home and to make sure that they're checking their blood sugars, because COVID-19 can reduce your appetite and cause you to eat less. It's really important to make sure that your blood sugar levels don't drop that much, and that you are still eating food to keep your blood sugar levels at a good level. And you also need more fluids when you're sick, which again, so keep water close by, but even drinking water can often lower your blood sugars even more. And some over-the-counter medicines for fever or cough can also affect your blood sugar levels, so it's very important to pay close attention to that and keep track of blood sugar levels.
Hi everyone, my name is Taylor Batten, and Jane and Brooke did a great job describing earlier in the video about popular questions related to COVID-19 and diabetes. So I just wanted to kind of give a little blurb, because I'm actually type 1 diabetic myself and was diagnosed with COVID-19 back in September. So I just want to give a little personal experience. I think it's very important with having COVID to make sure you keep your blood sugars in tight control, because I mostly had a positive experience with it. But I think that I'm very lucky, because in the last year, I was able to keep very tight control of my blood sugar levels. I used a t:slim pump and Dexcom CGM, so I think those definitely contributed to the tighter control. And although this is my individual experience, it is different to every person. Just because this was my experience with being diabetic and COVID doesn't mean that it will be everyone's experience. I was very fortunate because I was able to keep tight control of my blood sugars even with COVID. My symptoms included a sore throat, runny nose, congestion, I did not have any ketones and my blood sugar ran pretty normal. Only issue I had, I definitely didn't have much of an appetite, so I had to make sure I ate more to keep my blood sugars level because they were running on the little bit of a lower side. But other than that, I didn't have a fever, a little bit of nausea here and there, but overall it was just a pretty normal experience for me. It lasted about 10 days and I've been healthy ever since, so I've been very fortunate for that. But I think it's definitely important to make sure that you keep tight control because every experience will be different, and to make sure you're taking the precautions because COVID definitely exists and it is something that you need to watch out for. And I hope everyone enjoyed watching this video. Thank you.